I'd like to introduce Melony Farrar. Melony's going to tell us a little bit about, or hopefully a lot about, Bellafill. So please tell me what makes it so special.
Sure. Well, I'm going to talk to you about the three beauties of Bellafill and why it's unique. And the filler market is full of options, and that's important. I think it's unique to have different options because fillers are meant for different areas. So the beauty of Bellafill is unique in that we offer three things. But let me describe this first. As we age, specifically after the age of 35, we're losing significant volume in our face each year. So in order to combat that, you really need to replace the volume with something, and that's where a filler comes into play. So it's important to find and pick the right filler, and a safe filler. So that being said, when you have that breakdown of collagen in the skin, your fat pads in the skin also move around and break down, which causes folds and lines and
Is that
things
why
you
we
want to
get
avoid.
the jowls and we get the cheekbones coming down,
Yes.
the cheeks kind
Everything
of come down?
starts to deflate.
It does. It moves downward. Gravity.
It does, it does. So again, a filler is the best way to combat that. What's unique about Bellafill is three things. Again, we provide immediate results. So when you come into the practice and you have Bellafill injected, let's say we're talking about the nasolabial folds, you'll see immediate results. You'll walk out of the office feeling more beautiful and again, satisfied with your results. The second unique thing about Bellafill is that we are a collagen stimulant. So what that means is that Bellafill will push your body to recreate its own new collagen underneath the skin, specifically where the injections took place.
So that means that a little over time, weeks, months, it will stay full and continue to fill in on its own.
Correct. And the beauty of that is not only does the collagen create stimulation, you'll have new vascular stimulation too, so you'll see changes in the skin, the texture. We call that the Bella glow. The third and most important thing about Bellafill is that we are a 5-year filler. So we are a longer-term filler. We're indicated by the FDA for the nasolabial fold or considered smile lines for up to 5 years.
Well, that's the longest filler on the market, isn't it?
Yes, it is.
Because I remember when collagen first came out 30 years ago, we had to go every 3-4 months because it would just get sucked out and we'd have to keep replacing it. So 5 years is a very long run for a filler.
So I like to call this the Louis Vuitton of fillers because the quality is there and it's going to give you the results that will last.
How is the cost compared to other fillers? Because it does last so much longer.
Of course. So again, being the Louis Vuitton of fillers, you may spend a little bit more in your initial injections. However, if you're coming back every year for, let's say, a traditional HA injection, you're not going to see that pocketbook decrease. You're going to see that constant, you're spending, let's say, $1,500 every year.
Now, is that an example
This
of
is an
Bellafill?
example of the nasolabial folds. She had Bellafill here and here.
Now, is that immediately right after? Same day?
I believe it is.
Wow. Now, does it tend to bruise? Do people get bruised by the needle, or is it a very tiny needle?
It's a very small needle, and again, I think that's really due to injection technique. And here at Dr. Berkowitz's office, you have premier practitioners.
Right.
Again, this is a male that has had nasolabial folds, and I'd like to show the male picture, even though it's not a super clear picture. But men don't want to be injected every year. They want to be injected once and one and done. And again, the beauty of Bellafill is that it's going to provide a natural look due to the collagen stimulation. And men want to look natural. They don't want to tell their buddy they had Bellafill.
How many more men do you find coming in for treatments than women? Is it increasing every year?
It is. It is increasing, I think, for a couple things. Awareness. Bellafill is growing within the marketplace. Again, providing a very natural look. I think we're seeing more and more men want to care about themselves, even when it comes to a neurotoxin, to eliminate wrinkles. So I think that's true.
Do you think that it's the men that get the idea themselves, I want to look better, or do you think that their wives and girlfriends are saying, look, this is what it did for me, you need to touch that up?
I think both. I think you definitely hit on both. Certainly, I think, men are becoming more aware of what's available, but women are also, they're trying new things, trying different fillers, trying neurotoxins, and they may have never in their life decided to get any type of cosmetic injection. So yes, I think that too is word of mouth.
And also the stigma has lessened so much about these procedures that nobody hides it anymore. We're all kind of proud to say that we did something to make ourselves look better. Do we have some more pictures here?
So this is an acne scar patient. So we are also indicated for immediate correction of distensible acne scars. And what that means is if you can pull a scar with your 2 fingers apart and it flattens out, Belafil is a great filler for that.
So not the real deep ice pick holes.
Not the ice pick scars. And the reason for that is sometimes filler can make that worse because it's bound down so tough.
Right. Well, that's an amazing difference right there. She looks so much happier too, smoother, clear.
Acne can really play a huge
now, is that
part
one
of
treatment right there?
No. In fact, this young lady had microneedling done. She had literally tried everything before she had tried the final result, which was Belafil. So
I always like to ask because I don't want people to have unrealistic expectations that they go in and in one time they're going to come out looking like that.
Exactly.
Do we have anything else?
We do have a video we can show.
Let's look at the video.
A lot can change in 5 years, except those smile lines you treated with Belafil. Because that's about how long Belafil will keep them smooth and filled. 5 years. Now you can always look your best without all those injections, appointments, and costs. Belafil is the only dermal filler that stimulates and maintains collagen growth long term.
Well, that was an abrupt stop right there. But I think we get the picture that we get 5 years out of it. It stimulates the collagen in your own skin, fills in scars from acne, and also fills in the nasolabial folds.
Absolutely.
So a lot of benefits, and it's affordable over the long run because you're getting 5 years out of it. So when you break it down, it's a better deal.
100%.
Thank you so much for coming in and telling us about that. And Belafil, that's the way to go, ladies and men. We'll be right back. Stephanie Engen is here today to talk to us about my favorite skin product, Definage. I use it. I love it. I'm in my 70s and I noticed a huge difference. Explain why it's such a great product, because it really is.
Yeah, I think the skincare market has so many options nowadays. So what makes Definage different is first, there is a natural mechanism of action that occurs when you're placing the topical product on your skin. And second of all, the defensins are activating your own stem cell bundle to create new basal stem cells. So both of those things are really kind of setting it apart from any other skincare line, because we're activating your own stem cell bundle to create new skin rather than turning over old skin.
Well, I like it because it's got that wonderful little, it's kind of like a microdermabrasion kind of at home that you put on twice a week.
Yep.
I use it twice a week. I think you can use it up to 3 times a week. And it is the best cleanser I've ever used because it exfoliates while it's cleansing your skin. So it prepares the skin, kind of roughs it up a little for what you're going to put on.
Yes, our 2-minute reveal mask is super popular. Makeup artists love it. It actually doesn't have any active ingredients in it, but it is a great sugar scrub exfoliating treatment just to get that buildup that happens to everyone's skin of like old stem cell, old skin cells, and just product buildup that happens. Our main 2 products are our 24/7 barrier cream, and this has 1 times the defensins in it, and then our 8-in-1 bio serum, which is like our hero product that has 5 times the defensins in it.
What I like is that in some products you put the serum on first. With your product you put the moisturizing cream on first.
Yes.
And then wait, and you don't have to wait that long. You can wait 30 seconds or a minute and then put on the serum.
Yep. So here's some before and after photos. We were actually just published in the Journal of Drug and Dermatology, and all the participants used the serum and the cream twice daily for 12 weeks. So you're just seeing a big improvement on a global scale of fine lines and wrinkles, a decrease in pore size, and just an all-over glow that happens with the skin when using this product.
And that's without fillers. That's just the natural topical.
Yes, yep, that's the topical cream. You can really see around the eye area just that decrease in even those coarse wrinkles, and that's after 6 weeks. Especially around the eye area, we're seeing that's just a natural place where a lot of wrinkles tend to happen. So using the 8-in-1 bioserum right around the eye area, you can go inside the orbital bone there to see just a great reduction of wrinkles there. And yeah, really around the jawline to around the lips there, you can see a decrease in wrinkles. And then the last slide is of you can go to the next slide. Oh, okay. You can go ahead and play the video then too. This will kind of show exactly what is occurring when the product penetrates.
Human
through the
skin
hair.
is a dynamic and ever-changing part of our body. It needs daily care to keep it vibrant and youthful looking. The Defensins in Definage work with your body's stem cells to create beautiful new skin.
Well, that gives us a good idea what it does. I know I was so happy when Dr. Berkowitz turned me on to this product, because there are certain products that you buy that don't really penetrate enough to do anything.
Yes,
And this
yep.
is one product that does go deep enough to make a change, as we could see from that.
Yep. Mhm.
And what's the price point on this? People like to know what things cost.
Yes, $285 retail for the full clinical power trio, but you can purchase individually too. And we just developed a cleanser that came out this month, and we have an eye cream that's coming out in February.
Well, that's good to know about the eye cream, but I find that your serum is really nice around the eyes.
Yes.
So I always put a little extra
Yep.
serum just
It
around
works
the eye
very
area.
well there, and that product has 5 times the defensins in it, so it's really great for around
Well,
the
thank
eye
you
area.
so much. Definage, write it down, buy it, and you will be happy. Thank you so much.
Thank you.
Say hi to Todd Price. Todd, you've got looks like a toy to me. I'm not sure what it is, but it looks like something I want to buy. Is this something that I can buy or the doctors buy?
So the physician actually purchases this. So what it is, it's actually a 3D camera with a stereoscopic lens. So what we're able to do is reconstruct the face, breast, and body in a 3D image to help better bridge the communication gap between the patient and the physician for potential treatment outcomes. So the idea here is to show the patient themselves in a way they've never seen themselves before, because typically we're seeing ourselves, in the mirror, a 2D representation of ourselves, and you have an idea of how you see yourself, which could be vastly different than how the physician sees you, or people walking down the street, for example.
It's 100%. Trust me. How I see myself in the mirror and how others see me, I know is different. So this really will give the patient a blueprint.
That's right.
A map of what needs to be fixed.
Right. It's
and
sort
what
of,
the troubled areas are.
Right. It sort of grounds them and helps them sort of see objectively what their, their problematic areas, and it helps the physician better communicate what treatments are going to be necessary and maybe how many treatments are going to be necessary to have a particular result. Specifically, what we do is we show volume change. So for patients who maybe they don't think they need any filler anywhere, but we can take their photo in 3D and actually show them where they would benefit from having something like a filler. This is actual before and
Well,
after
I know
here.
you did one for me, and I was amazed when I looked at it. I didn't realize I had these little hollows on the sides of my temples,
Right.
and because I never noticed it. Now I'm aware of it. So
Exactly.
it's
Exactly.
a new area that I can attack.
That's it. Just like our motto is see differently, and it enables the patient to just do that exactly.
And also, it sees things that the naked eye doesn't see, because it
Absolutely.
sees underneath. It sees rosacea, and it sees a breakdown in the skin,
Right,
and
including
sun damage.
Exactly. So, and with this, the patient is actually able to be sort of in the mind of the physician the entire step of the way during the treatment process. So the physician can actually bring up a before and after image of the patient and show them the progress of their treatment in real time. So for certain treatments that may have relatively minimal change to the untrained eye, so the patient, they're able to actually quantitatively see those changes in real time during the consultation. So what we do is we just elevate the consultation to a whole new level, so the patient really feels in tune with the physician and what are the necessary treatments to get a particular outcome.
It's like very futuristic.
It is. It really is. I mean, we're as we say we're the game changers of the imaging industry, because it really just takes on goes to new heights in terms of the consultation experience. So instead of someone just receiving information from the physician saying, look, I think you should do this or do that, they can objectively see those problematic areas and understand a little bit better as to
So
what
it's a
needs to be done.
diagnostic tool.
Absolutely.
Do you have,
And a
okay,
communication
let's see. Now
tool.
that's to show the texture there?
That's right. So what we do here is we can actually show, so for example, this particular patient had her tear troughs filled and her nasolabial folds. And if you look in the before image on the left-hand side, you can see significant hollowness underneath the eye. And in the after image, you can see that that's all gone. So the physician doesn't even have to even communicate that. The picture is literally worth 1,000 words or $1,000. So it's the same here, just a simple before and after image of a filler in the cheeks and in the lips. And here's where we can actually measure volume change. So what we do is actually overlay before and after images, and we can measure in cubic centimeters the differences. So either whether you've retained volume from your previous procedure or perhaps you've lost volume, but as a patient, maybe you're not seeing that. You're not, again, you don't have the same the same trained eye as the physician. So now they can take your before and after image and show you where you've had that volume loss and encourage you to do more treatments.
Obviously, yeah. So that again measures the volume of the filler. and
Exactly.
if it's in the right place, if you needed more
Right.
than what you thought you needed.
Exactly. So we also do body imaging as well, and it's all done with a portable device here. So what we do is we do 360-degree images. So with that, we can do circumferential measurements, we can measure volume, and we actually have a new feature we call our silhouette feature. So the patient can actually visualize their transformation right in front of them. So again, if they're doing some sort of laser treatment where the results, again, they're relatively small to the untrained eye, they can actually see and understand, from a patient perspective, where their money is going.
So
they're
you're
spending
showing a projection. You're showing them ahead of time. This is how it's going to look.
So we can do that, but we can do it in real time in terms of having the actual before and after standardized next to each other. So we overlay the before image, and then we do the procedure, and then take the after
they can
picture.
actually
They
see
can
what was
actually see
done.
the difference.
That's amazing that you can do it for bodies as well.
Absolutely.
Now, does this add to the cost of a consultation?
It does not. This is typically included in the cost of the consultation. It's a tool to help elevate the consultation and bridge
How
that
many
communication gap.
cosmetic surgeons use that and dermatologists?
So right now we have over 600 users in the United States.
And Dr. Berkowitz is one of them?
Soon to be.
Soon to be. Okay. He's always the first to come up with the newest the best. That's what we love about Dr. Berkowitz. He's
right.
always ahead of the curve. So he'll have that soon.
I hope so.
Well, thank you so much for showing us that. I thought it was something I could just go out and buy and do it myself, but now I know I have to come in here to get it done.
That's right. Well,
Another excuse to come in.
That's it. It's a way to differentiate your practice.
Thank you so much.
Thank you for having me.
Fun to learn something new every day.
Great.
Thank you so much.
Thank you.
I want to welcome Jody Yee-Thomas.
Thank you.
So
Thanks
nice
for
to have
having
you here.
Thank you.
Tell me what you're here about, hair growth.
Hair growth,
And that's
yes.
something that everybody's interested in, men and women.
Absolutely, and doesn't matter, age. We have young people who start to lose their hair or just notice a little bit of thinning, or you just want healthier, more luxurious hair. Or we, anywhere from 18 up to we have people in their late 60s, 70s that really want to, start the process of growing new
Explain
healthy
how
hair.
it works, because this is something that you actually ingest. It's a pill.
Yes, it's a vitamin. So just like our bodies need nutrition and vitamins, our hair follicles also need the same. So it's essentially food for your scalp and hair and skin. It was actually discovered by a group of scientists in Scandinavia, and they were studying a group of Inuit people who naturally they had this luxurious, beautiful volume of hair, radiant skin, and they studied what they were eating, and they found that there was a common denominator, and that was that they were eating a high concentration of marine protein. So the premise behind these vitamins is derived from shark cartilage and from a sustainable source. It also has other ingredients such as amino acids. It has extracts and that are helpful for nutrition and just the health of your skin as well.
Now you take one a day?
They look like this, and you want to take one in the morning and one in the evening.
So 2 a day.
For the first 6 months to a year. After that, you can maintain it once a day. So it's very affordable. This little pack, this is a 60 tablets, and this is $60. So it's basically $1 per tablet.
And then how soon do you normally see an improvement? Because it's so
Yes.
hard to tell we have so many hair follicles that you really can't count the new ones that are coming in. So
Exactly.
how long?
Typically, some people will see results sooner, but typically around 3 months when you notice the shedding will decrease. You get out of the shower, you notice as you comb your hair out, you'll see less hair loss. And then within 6 months, 3 to 6 months, you notice a thickening of the hair because it does also change the diameter of the hair as well, and new growth.
So this could be used in combination with different hair restoration procedures
Absolutely.
to keep it up so the new hair stays healthy and good and you don't lose as much of the surrounding hair. Is that correct?
Absolutely. The more you do for hair loss, the better. They find with more modalities that you use. I know Dr. Berkowitz uses a lot of other options, hair transplant, PRP. This is something in addition that you can do to kind of maintain the results.
Explain what we're looking at right here.
So this is from day 0, so the starting point baseline, and then after 90 days of using the supplement twice a day, and you can see the general thinning pattern of all 3 of these women in the frontal area, and you can see after 90 days how that volume, the thickness of the hair starting to kind of fill in, and it continues to accelerate and get better as you continue to use it. So this is not the end of it after the 90-day period, but that's usually when people start really seeing great results.
So the longer you stay on this, the longer and better the results.
Exactly. It'll
Continue.
taper off, of course, and you'll get to a point where you want to maintain the results that you have, but it will continue to improve for the first 3 months to 6 months, and then maintain that.
Is the #1 area, especially for women, around the temples in this area in here?
That's usually where you see the first signs of hair loss for women. I know with men it's usually in the crown, also the receding hairline as well, but it's just going to just give you more volume as well.
And it does stimulate new hair growth and
Yes.
keep the hair that's already there healthier so that it doesn't fall out as rapidly?
Absolutely. It keeps the hair in the growth phase longer and also encourages new hair growth.
Well, for $1 a pill, it's
Right.
pretty easy
Very
and
affordable.
affordable. And is that available here at Dr. Berkowitz's office?
It is. This is a professional strength, so there's actually a over-the-counter strength, but this is much more powerful. It has the higher percentage of the active
You might
ingredients.
as well go for the highest. It works the
right.
best and the quickest and lasts the longest, correct?
And the best results, absolutely. Patients will see 80% improvement after 6 months and 57% improvement in the first 3 months.
That's a high number.
That's
And
absolutely
you back that
remarkable.
up, right?
Absolutely. There's multiple clinical studies. It's been proven to be safe and effective for over 25 years.
Wonderful. Well, thank you for that. And I know a lot of people out there who have thinning hair are thanking you for that as well. So we appreciate your time.
Thank you.
And we're
Thanks
going to
for
look
having me.
into that. Tell us the name again.
It's called Viviscal.
Thank you so much.
Thank you.
Well, thank you all. Hope you learned a lot. We had some really good people telling us about new products, new procedures. We'll be back next week with Dr. Berkowitz and more Accent Your Beauty.